Today we will discuss about the anterior triangle. We will reflect the skin of the anterior triangle, and the structure forming the roof of the anterior triangle are mainly the skin, superficial fascia. These are the yellowish color, it is the superficial fascia, and there is an investing layer of deep cervical fascia. Along with it, here you can see this is the platysma muscles. So this is the platysma muscles, and along with the platysma there is an investing layer of deep cervical fascia we have reflected. So roof of the major portions of the anterior triangle, it is formed by the skin, superficial fascia, investing layer of deep cervical fascia and platysma muscles. Basically the anterior triangle, it is further subdivided into the here you can see anteriorly it is from the symphysis menti to the goes anterior midline up to the superior part of the manubrium or upper border of the manubrium. It is this is a sternal notch or manubrial notch. So anteriorly it extends up to the symphysis menti to the end, then it goes downwards into the Adam's apple. This is the it is the most prominent part of the thyroid cartilage. Then it goes downside and it is up to the superior border of the manubrium. Posteriorly, the anterior triangle, it is bounded by the anterior border of the sternocleidomastoid muscles. Posteriorly, the anterior triangle, which is bounded by the anterior border of the sternocleidomastoid muscles, and base it is formed by the from the symphysis menti to the angle of the mandible. It is a base of the mandible. From the angle of the mandible to the mastoid process, this is a to draw the line. It is the base of the anterior triangle. So this is the from the mastoid process to the symphysis menti. It is the base of the anterior triangle, and the apex of the anterior triangle where there is a meeting point of the anterior midline, and there is a anterior border of the sternocleidomastoid. This portion it is called the apex of the anterior triangle. Anterior triangle, which is further divided into the 3.5 triangle. The midline triangle on the both the sides, which is bounded by the anterior belly of the anterior belly of the digastric muscles. This is the right side anterior belly of digastric, and this is the left side of the anterior belly of digastric, and base it is formed by the hyoid bone. So this is the an apex, it is the symphysis menti. So this is the submental triangle. It is the unpaired triangle, it is lies inside the midline. Remaining 3 triangle, both are present: digastric triangle, carotid triangle and muscular triangle, which is present on the right as well as left side. So the digastric triangle, this is the another triangle. Before we will start the digastric triangle, the content inside the submental triangle, it is the submental lymph node, and here you can see there is a one vein. It is the submental vein, and it becomes continuous as a anterior jugular vein. So this is the content inside the submental triangle, and floor of this triangle, which is formed by the myloid muscle. Here you can see this is the floor of this muscle, which is formed by the myloid muscles. The second triangle, it is the anterior belly of digastric. Second triangle, it is the digastric triangle. Digastric triangle, anteriorly and inferiorly, it is bounded by the anterior belly of digastric. Posteriorly and inferiorly, here you can see this is the posterior belly of digastric. Along with it, there is a stylohyoid muscles. So this is the stylohyoid muscles. From the styloid process to the hyoid, it is the stylohyoid, and this is the posterior belly of digastric. The base, which is formed by the lower border of the mandible. Roof we already discussed. It is formed by the skin, superficial fascia, investing layer of deep cervical fascia and platysma muscles. It is the roof. The floor, right now we have not dissected, but it is formed by the part of the myloid muscles, hyoglossus muscles and middle constrictor on the posterior sides. So these are the floor, and it contains mainly the submandibular gland. Here you can see this is a facial artery, facial vein, facial vein. We have got here the facial vein. So here you can see this is the facial vein. Facial vein and facial artery, submandibular gland, and inside we have not right now not dissected the submandibular ganglion. This is the submandibular lymph node. This is a submandibular lymph node. So these are the main content of the submandibular digastric triangle. And this is the posterior part of the digastric triangle. It is called the parotid part of the posterior triangle. From the angle of mandible to the mastoid process, this portion of the digastric triangle, it is called the parotid part. Mainly it contains the parotid gland, superficial part of the parotid gland, as well as there is a deeply it lies to the branches of the cervical and marginal branch of the facial nerve, retromandibular vein, and there is a external carotid artery which is lies inside the. These are the structure which is also lies inside the parotid gland. It is lies inside the parotid part of the digastric triangle. So the digastric triangle, it is actually divided into the two part. This is the anterior part. It is called the submandibular part, and this small portion, it is called the parotid part of the digastric triangle. The third triangle, it is formed by the third triangle. It is the carotid triangle. It itself suggests that there is a carotid vessels which is lies inside the carotid triangle. The boundary of this above and front side, it is the bounded by the posterior belly of digastric. Above front and anteriorly, it is bounded by the superior belly of homoid, and posteriorly it is bounded by the anterior border of the upper part of the anterior border of the sternocleidomastoid muscles. So this triangle, it is called the carotid triangle. So above and so front and above, it is bounded by the posterior belly of digastric along with the styloid muscles. Front and below, it is bounded by the superior belly of homoid, and the posteriorly it is bounded by the upper part of the sternocleidomastoid muscles. And the carotid triangle roof, it is formed by the skin, superficial fascia, investing layer of deep cervical fascia, and there is a transverse cutaneous nerve. Here you can see this is a transverse cutaneous nerve which goes inside the carotid triangle inside the roof. The floor which is formed by the above, there is a floor of the carotid triangle which is formed by the anteriorly and inferiorly thyroid muscle. This is the thyroid muscles. Above, it is formed by the hyoglossus muscle. This is the hyoglossus muscles. Just above it, there is a hypoglossal nerve. This is the hypoglossal nerve. And posteriorly, there is a upper part, middle and inferior constrictor, but we have not dissected. It lies on the posterior side of the carotid vessels. So this is the structure which are forming the floor of the carotid triangle. So thyroid, hyoglossus, both are anteriorly, posteriorly middle and inferior constrictor, but we have not dissected. The content itself, it is suggests that the carotid vessels which lies inside the carotid triangle. Here I will just reflect the part of the carotid triangle. This is the internal jugular vein. This is we have not dissected right now, but this is a common carotid, and it divides into the internal and external carotid artery. And this external carotid artery here, this is the external carotid artery. It gives the many branches inside the carotid triangle, mainly the superior thyroid, then the lingual, which goes inside the tongue, the facial, which goes inside the face, and ascending pharyngeal, and the occipital artery on the posterior aspect. These are the 5 branches of the external carotid artery which is emerging from the carotid triangle. And on the posterior side, there is a between the carotid sheath on the posterior side vagus nerve. Also there is a 9th, 10th, 11th and 12th nerve which is lies inside the carotid triangle. This is the hypoglossal nerve, and the vagus nerve which is lies inside the carotid sheath on the deep aspect. And the spinal accessory here you can see which is coming from the posterior aspect. This is inside the posterior triangle, but we have not dissected, but here at that level there is a spinal accessory nerves, and the glossopharyngeal which is lies on the medially inside the pharynx. So these are the content of the carotid triangle. The last triangle inside the anterior triangle, into the anteriorly into the midline, it is bounded by the anterior midline, and posteriorly and superiorly it is bounded by the superior belly of the omoid, and posteriorly and inferiorly it is bounded by the lower part of the anterior border of the sternocleidomastoid. So this portion, it is called the muscular triangle. It is the muscular triangle, and mainly it contains the infrahyoid muscles from the into the first layer for the better visualization. Inside the muscular triangle there are infrahyoid muscles. This is a superior belly of omoid. Here you can see I have got this is the inferior belly of omoid, and I have got it from the midlines, and this is the sternum to the hyoid, it is the sternohyoid, and just below it sternum to the thyroid, it is the sternothyroid, and thyroid to hyoid, it is the thyrohyoid. All these muscles which is innervated by the ansa cervicalis. Here you can see this is the branches of ansa cervicalis. This is the superior root of the ansa cervicalis. This is the inferior root of the ansa cervicalis. The superior root, the fiber which is from the superior root, it is along with the hypoglossal nerve. It is called the descendant hypoglossi, and it supplies to the genioid and thyroid muscles from the directly from the fiber of the C1 which is along with the hypoglossal nerve, and it is supplied to the thyroid and genioid. Here you can see these are the small branches which is goes to the thyroid and genioid muscles. So, and this is the ansa cervicalis itself. It supplies to the here you can see this superior root also supplied to the superior belly of the omoid, and the ansa cervicalis itself, it supplies to the inferior belly of omoid. Here you can see this is supplies to the inferior belly of the omoid, the part. It also supplies to the sternohyoid and sternothyroid muscles. Here you can see these are the two nerves, sternohyoid and sternothyroid, which is supplied by the ansa cervicalis. So the inferior root which is formed by the C2 and C3 fibers, and it is wind around to the in front of the internal jugular vein and common carotid artery. So this is the muscular triangle. It is also because it mainly presence of the muscles, that's why it is called the muscular triangle. So this is about to the in brief we discussed the anterior triangle. We have not dissected completely in deep dissection of the anterior triangle. We have not right now dissected the external carotid artery. Thank you.